Listen up. When the NCLEX drops one of those which is the highest priority questions, and you're sitting there thinking, well, geez, Jimmy, all these look alike. I don't know which one to pick. Well, I've got a trick for you. I promise this will be a game changer. It's called the if I walk into the room, do one thing, then ghost forever test. Here's how it works. You imagine you stroll into the patient's room. You can only do one of the answer choices. Then you vanish. Poof! Never come back. No second chances, no do-overs, no superhero nurses showing up later. Now ask yourself, which one thing actually helps the patient the most right now? Not later, not after the doctor's orders, right now. So let's try it with a question. Ready? Cue game show music. All right. The if I never came back test. Okay, the question is, you walk into Miss Rivera's room. She's post-op from abdominal surgery this morning. She's pale, sweaty, and says, I feel lightheaded. You can only do one thing before disappearing into the nursing abyss forever. What are you going to do first? A, recheck her blood pressure. B, elevate the head of the bed. C, start a bolus of IV fluids as ordered. Or D, call the provider. Pause this video and go back and use the method, and let's talk. All right, let's get into it. Option A, recheck her blood pressure. Cute idea, but if you disappear right after, that number isn't going to save her. It's like checking if the fire alarm's ringing while the house burns down. All right, option B, elevate the head of the bed. Brilliant! Because who doesn't want to send less blood to a dizzy patient's brain? I'm sure that'll end well. All right, and option D, call the provider. Classic pass the buck move. Say, hey, something's wrong. Then ghost like a bad date. Real helpful. All right, so what's left? Option C, start a bolus of IV fluids as ordered. This actually treats the problem, likely low blood pressure from surgery or fluid shifts. So if you disappear after this, at least you gave her a fighting chance before you vanished into thin air. So yeah, that's it. So when you're stuck on those ugly prioritization questions, just imagine you have one and only one chance to make a difference before becoming the nursing version of a magician. All right? Hope that helps. It helped me. I'm Nurse Jimmy. We'll talk soon.